Hello, Lakeshore. Welcome to Mindful Monday. I hope you're having a very good start of your week. Mindful Mondays are where we take a pause to coach ourselves, to support ourselves, to be in the present as best we can, letting go of the stress that might come across as depression, which is our worry about the past often, or resentments, anxiety, which is our worry about the future, the things that might happen, might not happen. So today you're joining me, Carolyn, your counselor here at the Lakeshore, for Memory Support with Carolyn. And so today I want to have a discussion with you, although I remind us it's still a one-way discussion in the sense that you don't get to interact with me during this time. But I always welcome, as you know, your comments, your suggestions. I bring you topics for food for thought, ideas, and encourage you to explore the ideas and to find what fits for you. Today, I want to talk about memory, and I want to talk about memory. We offer our memory support here at the Lakeshore for anyone who may be worried about their own memory, or for anyone who knows somebody who is maybe struggling with memory. I really appreciate this topic. It's a very dynamic topic, and there's a lot that we can know about memory and a lot we can understand. And there's actually a lot we can do to help us preserve our memory, to help us understand when we're struggling with some memory, and then also how to kind of maintain our memory and how to make even new neural pathways. So today, I hope by the time we end this talk that I have given you some thoughts first on what causes memory loss. So I'm going to touch on some different things that will affect our memory, because when we understand the causes of memory loss, sometimes that also gives us clues as to things we can do to help address if we ourselves, or if we know someone who's maybe struggling with some memory issues. The second thing I hope to leave you with today is some tips on how we can improve our memory, how we can maintain our memory. So here we go. I hope you get those two things out of today. First, as we jump into this topic, I want to say in general, there are a lot of things that can affect our memory, and a couple of areas. So just give thought for a minute. I'm going to ask you a question. If you were here, I would be saying to the group, what are you aware of? What are the causes that you know of for memory loss or for memory challenges? So think about that for a minute and be just kind of mentally making your little list as we get into this subject. I'm wondering if I'll surprise you with any causes or things that cause us to struggle with our memory in the list that I present. So I wonder if there'll be any new surprises for you in this list, or if they're all kind of the things you already know. I suspect that I'm going to make a couple of comments that may be news to you as far as things that can actually create memory loss. So as we get into that, and as I begin to share with you my list of things and items that I came up with that can affect our memory, you can cross over and see if it matches your list and if there's any things you would add to some of the causes for memory loss. But as I get into that list, I want to just start with a couple comments in general. I think this is a really timely topic because of COVID-19, because of our being asked by the public health leaders for us to be physically distancing from one another. I always like to say physically distancing as opposed to socially distancing, because we need to find ways to be socially connecting. We just know from the information we have at this point on the virus that the closer we are to one another in proximity, the more maybe at risk. So there's some things that we can do. But it's probably not surprising to you that collectively We are all, I don't care the age we are or our background, we are suffering. Our memories are suffering. And so it's not surprising that one of the things you may know that can cause, or not, I don't know if I want to say cause, but can contribute to memory problems is isolation. So when we aren't seeing people, when we're out of our routine, that can greatly affect our memory. And so there's even things we can do just to hopefully reinforce our sense of routine, our sense of ourself during these strange times. But being isolated, not having those connections, that can present challenges that can then translate into memory challenges or memory problems. The other thing, and why I thought this is such a timely topic, is because I think there are also, I want to call sort of feeling contributions, maybe things we think about as our emotion, or about how we're dealing with the world, moods and feelings. So I wanted to touch on that because that also connects with what's happening during these strange times between the pandemic of the virus, as well as the reemergence of the epidemic, but I also would propose probably the pandemic of racism that has existed for decades, for centuries. And so we're really having some social stressors in our world and in our lives. And some of you are more directly affected than maybe others of us, so we're each affected depending on our particular circumstances. So I'm going to talk about that a little bit today, how actually trauma, depression, anxiety, will affect memory and actually create memory problems for us. So that's what another reason mental health is so important, is because when we have tools to deal with these stressors, mental health isn't something, again, that we're just born with, that it's good or bad, but something that actually, just like our physical health, we should be paying attention to. And there are factors, there are contributors that we can be attentive to that improve our physical and mental functioning in life, just like there are things we can neglect or pay attention to that actually inhibit or take away from our physical and our mental well-being. So that's kind of the spirit I come to you today as we talk about memory support in our community. So continuing on with the causes, it is so interesting to look at us as human beings in the connection of our body, our brain, and then as a social worker, I was trained in what's called systems theory. And so systems theory is just the concept that it's kind of like the math concept of numbers and what group do the numbers belong to and what subset do they belong to. So as human beings, we have qualities, characteristics, where was I going with this? That contribute perhaps to some of the circumstances or the qualities. But if we look at physical and mental health as neuroscience has really opened the door for us to see more clearly as a connection and as an interaction that's going on. And so we now know in science, whether it's medical science, mental health science, that the physical doesn't exist in isolation from the mental, and our mental is not separate and existing and separate, but in fact we're an entire system as a human being with that mental physical interaction going on, and then the emotion we could think of as the energy that comes forward, good, bad, indifferent. So the result of this interaction that's happening. To take systems theory a little bit further, then we can also say that not only as human beings do we have our own internal chemical, mysterious interaction going on of the body-mind, but also influencing us is our environment. And so the neighborhoods we live in, the people who surround us, let alone do we have clean air, clean water, and clean food to eat. Those are three things that are actually brain medicine. And then social. All of these things are things that fuel our mental status awareness, our physical health, and again, create that sort of interaction in our mental and physical selves. So what's going on in the world, to put that, what I just said, to rephrase it in a different way, what's going on in the world is going to affect me as an individual, it's going to affect you as an individual, it affects every one of us. Now it's going to affect us differently depending on our worldview and our experience. Likewise, the foods we eat, the water or the liquids we drink, what we put on our skin, clean air, clean food. The air we breathe, is it clean of pollutants? All of those things are also impacting and influencing our individual systems. And so we aren't little islands, but we really have a lot of things contributing to our health or contributing to our health problems. So causes of memory loss. Get that list out that we were talking about. And what did you put on your list for causes of memory loss? Some of the things that we're a little more aware of, maybe because we hear more messaging on this, is you may have heard the message around alcohol, drugs, and tobacco. All of those things affect memory. So medications, sometimes there's a side effect that can actually even influence memory, or sometimes it can create other side effects in the body that may be affecting memory. So it doesn't necessarily mean that we're not going to take the medication, because the benefits of the medication may outweigh some of the side effects, so to speak, that we're getting. So that's a conversation that we have to have with our doctor to really put in perspective the benefits of the medication if we're having some side effects. But sometimes medications will affect memory. Now, that's helpful to know, because what I see from a mental health standpoint is that there's a lot of stigma, a lot of bias around memory. So I will hear people, including myself at times, criticizing themselves, belittling themselves for having a memory problem. Years ago, not too long ago actually, we still fall under this umbrella, we will say things about memory such as, oh, it's just natural, I'm just getting old, it's just a byproduct of aging. So interesting. Memory does not necessarily, sorry, there's a little radio going off in the background, so if you're hearing a noise, try to just acknowledge it and let that go. But I wanted to just identify that in case that's coming through in the video. So what will actually then limits our conversation and our understanding of memory is when we put it in a category and we call it Alzheimer's. And that's not even the real name, or the real name of one type of dementia is called Alzheimer's. But we have a, what's the word that I'm looking for? We have a fad name, that's not the word I'm looking for, but where we lump it under Alzheimer's. And it's just the aging process. So not true. Many of us will age throughout our lives and die of a ripe old age and not experience anything other than sort of normal memory flares or memory problems. Others of us may go on to actually develop a diagnosis related to our memory. And so that's kind of another category, and we will talk further about memory illnesses, diseases that affect our memory as well. So that's also a category of what can affect our memory. Is sometimes we acquire an illness or a disease directly related to memory, and that umbrella is called dementias. And then sometimes under that umbrella of dementia, which dementia just means problems with memory. And some problems with memory will resolve, and we will go on to find that we have improved memory. Sometimes we will find that certain levels of memory may not resolve or improve, and then sometimes we may find that there's a diagnosis connected with memory. But I think that part of the bias around memory is that we feel ashamed, like there's something inadequate about us, or that somehow we are less than if we're having memory problems. And memory problems are no different than any other health issue. They are a symptom. And the more we can be open with how we're experiencing things, the more options will come to us, but also the greater the stress relief will be. And I'm going to talk about stress in a minute and why that's so important, to not be harboring secrets or keeping ourselves from getting information about something that concerns us, because that becomes a secret even from ourselves. Sometimes we don't go talk to our doctor or a counselor or a nurse or whoever because we don't want to acknowledge we're having the problem. We're afraid what we will find out. It's one of the maybe number one health reasons that we avoid certain medical appointments, because we're afraid of what we'll find out. But in reality, information is a basic human need we have. So when you get information about your concerns, it relieves. Even if it's not the information we wanted, it can help us in our memory, but also just in our daily functioning. Because even if it's bad news, then we can do something. We have some guides as to what we need. And anytime we're being honest with ourselves around what we need, that's just going to work out to our benefit in the long run. So anyway, some medications may have some memory connection, particularly if you get into medications that have mood-altering qualities, tranquilizers for sleep. Some of those things inherently can affect our memory. And so we need to be sometimes mindful, careful, but also following up with our doctors if we're noticing symptoms or problems with our memory. Sometimes the side effect is significant enough that we may need to find a different medication even to deal with the problem that we're experiencing. Smoking. Smoking changes the blood vessels. So anything that affects the flow of the blood in our body, so whether it's certain foods we're eating that are causing us to get those hardening of the arteries or clogged arteries, or smoking that affects our arteries, anything that is clogging the arteries or narrowing the passage for that blood flow in the arteries is going to affect memory. Right? That kind of makes sense, right? So obviously the blood is what carries the fuel to every cell of our body, our being. So from the brain down to the tips of our toes. So if we're not getting good blood flow, it is going to affect our ability to process nutrients, to get oxygen out to the body. And when we have deprivation of nutrients, that can affect our memory. So let me just touch on then. Food can affect our memory. We now have enough science to talk about, and if you ever speak with our nutritionists, our living nutritionists, or other dietitians, there's so much more information now about foods that increase and improve memory and foods that decrease memory. So we know leafy, dark green vegetables, the more color in the food in general, the more nutrient boost, so the more we might call those brain foods. The omegas, certain kinds of good fats, So we have so much more information about diet and what improves our memory. Likewise, certain foods can really affect our memory as well. So if we're living on a junk food diet, it affects our energy levels in all kinds of ways, but one of the ways we can see it manifest is in confused thinking, is in memory problems. So maybe you followed over the years some of the studies that have been done in schools for children who have good nutrition versus children who don't have good nutrition. And those children who don't have good nutrition, it affects their ability to process, their ability to remember. It also, when we're not getting good, adequate nutrition, regardless of our age, it will affect our behavior, and we may not even be aware of it. So it can cause us to act impulsively when we're not getting good nutrition, or when we have memory problems, we may be acting impulsively in ways we normally wouldn't act. We may be coming across and be presenting with irritability and may not even be aware of it. So there are a lot of things that can filter down and be affecting our memory, which then comes out as behavior. Because remember, whatever goes into our bodies, thoughts, words, nutrition, water, is going to affect the outcome, what comes out of our bodies, our words, our behaviors, our attitudes. Let's see, what else? So we've covered then illicit drugs, especially the more mind-altering. So the more the drug interferes, whether it's a legal drug, a prescribed drug, or an illicit drug that is designed to change the chemistry and to change the mood or the experience. Some drugs may cause euphoria, some drugs may cause us to just be sort of numb, and that greatly affects our memory. And then sometimes we're so challenged, we may not even, so you'll see this sometimes with people who abuse alcohol or drugs, they may have what we call blackouts or brownouts, but where we actually lose memory, and we don't have recollection of what others saw us do. And so that can be the crazy making sometimes of confronting somebody. Maybe you were there at some point in your life, or maybe you've known somebody, if they're abusing painkillers, alcohol, cocaine, all kinds of drugs that again affect our interaction the day, and then unfortunately often may leave us without a recollection of that period of time or that behavior that we were exhibiting. So sometimes it's very difficult to confront people on behaviors because truly they may believe they did not do that. And so that's another conversation for another day of how do we deal with sort of when there's a memory problem involved in a conversation we're having with ourselves or with somebody else. But moving along, so that's kind of the category of ingestion, again, including foods. So in junk foods, sugars are high. It's not that sugar is necessarily a horrible food, but sugar has been likened to heroin, cocaine, for how addictive it is and how mind-altering it is. So depending on when we're eating the sugar, what kinds of processed sugar, so a whole sugar that you would find in fruit is obviously going to be much better for us than a processed food like a Twinkie, which doesn't have any nutritional value. May taste good, but doesn't have any nutritional value that I know of. Let's see, what else? Also on my list, is this on your list? Sleep. We now are hearing, I think last 5-10 years, we've started hearing things about sleep hygiene. What is sleep hygiene? We now know our sleep hygiene is so crucial and important to behavioral and mental health, to memory, and to the choices we make, to how we feel. We have lived in a culture, a legacy that many of us inherited was a sort of a denial of some of the basic levels of health or needs that we have as human beings. So the world I grew up in, we minimized sleep. We didn't pay much attention to sleep. My father probably operated, both my parents, I think, operated for many years on 3 to 5 hours of sleep a night. They were incredibly productive individuals. They were workers. It's incredible what they each produced. But also I have to look back and wonder if it did not contribute to the diseases that they developed. My dad died at a very young age. I won't know. We won't know. But we do know from science that sleep is a huge, huge factor. I want you to think of it almost as medicine. And if we can't sleep, there's also breathing tools, some call it meditation, that we can do that helps the brain to actually kind of let down. Because the purpose of sleep is like a computer, it's helping our brain to reboot, if you will. It's helping us to release probably certain levels of stress, to work through maybe even problems we're having. But also when we start to have sleep problems, that can greatly impact on our memory and our health in general. So if you're struggling with some sleep issues, lots of tools and ways to address sleep problems, but we almost have to, again, practice sleep hygiene. And some of us have to begin to define what good sleep hygiene for us is. On my phone, I actually have an application where I can go into it and I can set my bedtime and what time I want to give up. It's going to show me how long that period of time will be for sleep. And so it's an awareness tool that I use now to try to coach myself to get to bed a little bit earlier. For many reasons, I get up early, so I'm not going to be able to change maybe the time that I'm getting up, so then I need to change the time that I go to bed. Now, I've also in my life at times suffered from insomnia and interrupted sleep, and those can be two different things. So some of us may not have any difficulty falling asleep, but then something wakes us up and we have trouble going back to sleep. Some of us may have difficulty falling asleep and we struggle, and right before it's time to get up, we all of a sudden are falling asleep. So there are many variations to the kinds of sleep problems that we will have. For some people, the feelings that come up when we sleep, like a dream. I had young people who are like, I hate to sleep because I have these dreams. And so dreams, again, are our body and our mind's way of working through problems. And sometimes we will wake up with the feeling that we experienced in the dream. And again, there are tools for us to be able to acknowledge that so it doesn't sort of leave a residual hangover feeling emotionally. But whatever your sleep challenges are, there is a remedy. There are so many tools and so many things to help us with sleep. And I hope to be doing more health support in our community around some of the ways we can work with our environment and with ourselves to help us if we're having some sleep problems. But sleep will greatly affect memory. It will affect retention. It will affect how we recall. It will affect how we learn things. And so the more sleep deprived we are, the more difficulty we're going to have in all of those areas. Let's see. So we've talked a lot about the things we put in our body. We've talked about some of the things. Oh, another thing I want to talk about very briefly because we get a lot of messaging about it. But again, water. And so I think of breathing, not the automatic breathing that we necessarily do, because sometimes we're not getting full deep breaths because of the amount of stress that we're feeling physically and mentally, and that will automatically change our depth of breath or type of breathing. So sometimes we need to practice actually checking in with ourselves, checking in with whether we're getting full deep breaths, and learning to do that consciously. So breathing is like a lubricant in the body, if you will. It's so I'm going to talk about for just a second breathing and water. And so I was thinking about the analogy, if oil to a car is the lubricant, for a human body, water and breathing are the lubricants. And so literally, scientifically, we know that oxygen can help to open up our veins, can help to open up kind of our system so that we're getting better flow. It also helps to release toxins that get stuck in our body or that are resulting from stress, all kinds of reasons. And likewise, water is literally a lubricant. It helps to thin the blood, and so our blood will flow better. I had a doctor many years ago tell me when we're not drinking water, when we're not staying hydrated, our blood becomes like sludge. So just imagine if you have a car, or when you had a car, it would be like not changing the oil in the car, and that oil starts to get thicker and thicker, and it's just not moving well in the engine, and eventually it will create engine problems. And so as human beings, we are very much the same. If we're not getting good lubrication in our blood, the blood is thicker and it's going to have a harder time passing through our veins. So that's why you'll see your doctor sometimes reminding you with blood pressure, be sure you're hydrating. And again, we need to drink a little water throughout the day. We don't need to consume 8 glasses all at once. That creates another problem that is associated with memory, and that is the loss of sodium. So again, there are lots of things that we ingest in our body, take in, that if they're depleted and they're absent, will greatly affect memory. Or if we have too much of something, it can greatly affect memory. And so things like sodium, potassium, and some of you have experienced it, tremendous confusion if we lose those in our body. So people who drink, there was a woman years ago who did a radio contest, and somehow, I don't remember all the details of the contest, but it was I think it was out of California, and the radio would have this contest to see how fast people could kind of drink water and how much water they could consume. And this woman won the contest. Unfortunately, she died because it so flushed her body of the sodium, the things that help the heart rhythm, the heart rate. And so that's where sometimes when our health is compromised, when there's something out of balance, we will also see memory problems. So it can be something that we cause by drinking too much of something, or not drinking enough, or eating too much of one kind of food, or not eating enough of another food. Or it can happen more organically in a disease process, that we get an infection that affects maybe certain chemicals in our body, or we get a diagnosis, a disease that is affecting, again, certain chemical processes. So that chemistry in our body, we're very... in some ways, we're so resilient as human beings, but then in other ways, we're very susceptible to these little nuances. And if we're undergoing them long enough, again, they can greatly affect us. So again, heat. We don't have this problem as much here in the greater Northwest as some of the other areas of the country, but when it gets too hot, again, we're sweating, we're losing all that sodium from our body, and if we're not drinking water and replenishing those electrolytes, we may end up with a symptom related to heat sickness, which is confusion. So again, confusion is sometimes a way we're showing ourselves in the world that something's really off in our body. Now, I want to spend just a few more minutes on my last category of things that affect our memory. And that's going to be a category I started in talking about today a little bit. And those are more the how we're impacted by situations and things in our life. And so under this category, I'm also going to include head injuries. So there are other things that can affect our memory. We used to not pay as much attention to head injuries as we do now. And this is a great contribution to what we've learned about head injuries from soldiers in the field who are in combat, as well as sports. So over the years, we've been accumulating more and more information about the impact of head injuries, the impact of impacts on our head. And so this is an ongoing and become an ongoing discussion in the sports world, in contact sports. Is what age is too young to be having contact? And what do we do with professionals who part of the hazard to their profession is head hits and injuries to the head? And how does it affect us if we've had injuries to the head, including throughout the life? So now I think part of our health history really should be including any significant head injuries, particularly if we've been knocked unconscious or suffered an injury, a brain bleed. So bruising, as you know, occurs when we have an injury and then those little blood vessels break and and so there may be bleeding internally and it discolors the outer skin. One of the difficulties of head injuries, and this is why you'll see it places like the lakeshore, but any place where there's head injuries, usually protocol will be if you've had an injury, if you've had a fall that injured the head, that you need to be checked out, because we know that oftentimes the signs of head injuries and the effect on memory or on our brain may be very insidious. We may not be very visible until all of a sudden we're really have a problem. So head injuries are definitely a category. We also now know that if we've experienced head injuries, car accidents, contact sports, fall, hit my head, those kinds of things, that we now believe that these things can also show up years later in some possibly dementia types of diagnosis. So that's an area that I'm excited to see more of the research as it comes out, because it's going to really help us to know more and how to respond and how to protect our health. So other things that may be a little bit invisible to us, greatly invisible to us, are things like trauma and reactions to everyday stresses and problems, reactions to health issues. And by those reactions, I mean our moods. So you've heard me say many times, probably. If you haven't, I invite you to hear this today. I always explain anger, anxiety, and depression as the three responses that are normal to abnormal things happening to us. So often we get caught up in them as a virtue, anger, depression, anxiety, as a virtue or a choice. And it's much more complex than that. We can greatly influence, and there are so many things that we can do to help if we find ourselves having anger, depression, anxiety. So lots to say on that. Sorry, that kind of takes me away. But so it's a very complex topic. But I want to reassure you, if you're experiencing anger, depression, anxiety, please reach out and talk to somebody, because there are so many things we can do to help ourselves. We do not have to suffer alone. And often we suffer because we think it's a character defect or something we should just be able to overcome, instead of realizing it's a symptom. Anger, depression, anxiety can be a symptom related to a situation we're moving through or going through, experiencing in life, or to a health problem. Again, they often are co-occurring. And so we maybe need to change our dialogue a little bit and see them as symptoms. I also want to treat depression and anger and anxiety as influences of our brain health or memory. So let me say in general, to wrap up the comments, kind of on the causes of brain injury. So I give us a few moments at least on the things we can do to maybe improve memory or to support our memory. But what we now know is also the more negative we are, the more stressed we are, the more filled with depression, which is anger turned inward, but depression is things like, what's wrong with me? It's a feeling sometimes of being worthless or impatient with myself because I can't do the things I used to do. So it's some of those kinds of qualities, where anger outside is a little bit more, it's like, oh, why is this happening? Why are you doing this to me? So it's kind of a reaction maybe to someone or something that we maybe are experiencing, interfering with our ability to kind of function or move about in the world the way that we perceive we need to. But the more negative we are, the more we spend time gossiping, the more time that we're caught up in complaining, at some point we move from that maybe being a bit of a healthy coping mechanism to it being unhealthy, and what I will just in general call rehearsing the pain. So anytime we're going over and over and over a problem we have, the more we actually may be contributing to memory problems without even knowing it. The more and more we are stuck in a problem that we can't resolve emotionally, like something that was unfair to us that happened, the more that will affect our memory. Now, under this umbrella, I also want to include grief and loss. When we experience a death in our circle of support, and the closer that death is to our love support or our health care or health support, the more impacting it's going to be on us. And part of the grief process is the effect on memory. So again, we can become very depressed, say, what's wrong with me? So sometimes we need some help to put our memory into context, to better understand, is this a big problem? I have a diagnosis going on. Oftentimes it's not a big problem. Many times it's a different kind of problem that is creating a symptom with memory. But if we don't address it, it can lead to a bigger problem. So I encourage you to be courageous and to have honest conversations with people that you trust. Find people that know about memory and that you can have some honest conversations. By the way, not all doctors are yet up to date. Not all healthcare professionals are up to date on what we know about dementia and memory. So just being aware as you go forward. But there are so much information. These last few minutes of our memory talk today, I really want to talk about how can we improve our memory, and how do we maintain memory? Do we recover memory? When I was in school 40 years ago, graduating with my undergraduate degree, we were taught some things that was science, and time has changed our science a bit. And so at that time, in anatomy, we were kind of taught as students, and as a social work student, I didn't have a lot of anatomy and physical health. Excuse me. Dry throat. today, probably in the field, we now recognize, because our science has advanced, so we now know, again, there's definitely a body-mind connection. There is a physical, mental, emotional connection. How we think is going to fuel how we feel. How we feel is going to fuel how we think. And so probably I would hope that we don't have quite as black and white categorizing as we did when I was in school. But 40 years ago, we used to say, well, you can't teach an old dog new tricks. So we would say things like, once you're creating neural pathways up to a certain age, and then we start to lose those neural pathways. But amazingly, as we've been able to scan the brain, what we find is we don't necessarily stop making new neural pathways throughout our life. And even in dementia, or with certain dementias, or maybe all dementias, there's been some research that indicates that we still have the ability to create neural pathways. And so a neural pathway is maybe an idea of a way for our brain body to work, for us to engage in the world, for us to understand the world. And sometimes no, I don't want to say that today, so forgive me for that. So anyway, it's very important. One of the things we can do to improve and maintain memory is stay mentally active. What does that mean? It's one of the reasons we actually play games. We play games also for the social component, but another important reason to do things like games, puzzles, is because it helps to lubricate the brain. It helps to activate the brain and engage the brain. And so we just know that anytime you're engaged in doing something that's interesting or challenging yourself, that is helping your brain to exercise. And just like we now know we should do certain movement every day, we also need to be moving our brain. We can't just sit back. That was the old picture of retirement. I'll just sit back, I won't do anything. Oh, that's boring, and none of you really enjoy that. Now we can sit back and we can create new work, like developing new hobbies, new ways of maybe meeting people, or new interests. I hope I never lose one of the tools that I use every day to kind of motivate myself, and it was a brain training that I did, where I began to train my brain to wake up not thinking about the problems. I may wake up thinking about problems, but I also began to train myself to wake up with an attitude of challenge, meaning who might I meet today, or what might I learn today? So that's one of the ways I challenge myself to stay mentally active. And I don't necessarily learn something new every day, but most days I think I do learn something new, and I hope that is a worldview, a purpose of my life that I continue to nurture until I can no longer interact with the world and learn something new. Socializing regularly right now, that means getting out of our boxes a little bit and to stop being mad that we can't socialize the way that we like to socialize and the way we want to socialize. So maybe you're having to figure out how to use social media like FaceTime or Zoom, which is where we can see and have a video chat. Or maybe you're using phones to just call your friends, your neighbors, and check in. I had a friend of mine who said, oh, the calls have tapered down. People aren't calling and checking in on me as much. And my response was, are you reaching out? Are you calling? And so it's a two-way street. People need to hear from you just as you may need to hear from others. And sometimes we may not feel like making a phone call, but maybe we might not even realize that just by reaching out and saying, hello, I'm thinking of you, that may be the very message a family member needs or a friend needs. And so while you're busy thinking what you don't have, One of the ways we can also help our brains is by thinking of somebody else and challenging ourselves to reach out to someone else. It's no different than months ago when we were in the community, we would say, well, just smile. It doesn't take a lot of effort, but that is helping our brain. We know that practicing kindness also helps our brain chemistry and helps memory. So by being friendly, saying hello, we may help that person to feel not a little less alone, but also we're helping our own brain chemistry by getting out of our own problems and by doing something, however teensy tiny it is, like saying hello. That is volunteering our time, our energy to another person. So I'm giving you some thoughts to begin to rethink some of these things that we take for granted and think of as simple and easy, and actually maybe they're a little more complex than we realized. And maybe some of these little acts of kindness are much bigger than what we thought. So if you're one that is sad that you no longer have maybe the purpose you used to have, I invite you to continue to explore what this stage in your life and what your purpose is, because you still have purpose. You have purpose up to the last moment of breath. And my particular spiritual view is that continues after we die. But that's just my own worldview. I don't know. So, get it simple. It isn't going to a job every day. Easy for me to say, I guess. But it isn't going to a job every day. It's how do we interact and how do we do things maybe for someone else and not minimize those gestures into nothingness. So if you said hello to somebody and greeted them with a smile, that is some of your purpose perhaps for the day. So some food for thought. Eating healthy diet, we talked about. Making sure you're doing some movement every day, even if you have some physical issues or the COVID-19 is and are needing to still shelter in place a bit is affecting your ability to move. We can do things. I try to, throughout my day, do little movements. I need to work on maybe doing some bigger scale movements, but what I do know is even at my desk or in my home, and when I'm not able to get out and about, that there are stretches that we can do. So even when you're watching TV, there are some things. So as you're watching me today, you could be doing some also arm stretches, some hand stretches. So in some ways, I will say, I don't know that it matters the type of movement, just that we're moving. That's the most crucial thing. So are you giving yourself challenges for movement within what is realistic and within your capabilities every day? Making sure you're staying on top of some of your health concerns and following up. And right now that's challenging because, again, it's a little harder for us to get out to go to appointments. But please see us, because we can also, as your staff here at the Lakeshore, help you to set up, again, a Zoom videotape meeting. It's confidential, it's private, you and your doctor. But we can help you to set that up, even on our own Lakeshore equipment, so that you can have an office visit if you're not wanting to go to the office, or if that doctor's not really wanting people to come to the office. There are ways that we can be following up. We can also do things to prompt our memory, sometimes making notes. But the main thing I want to stress today, if you do nothing else, be checking in with yourself and how negative you may be feeling, or how positive. And negativity can come in many packages. It can come out as sarcasm, it can come out as criticism, it can come out as impatience with ourselves. So there's lots of ways that we may be feeling bogged down, because again, these are the reactions when life is interrupted, when we have our routines interrupted. And then our challenge, our plasticity, brain plasticity, is can we get out of the box in how we've always done it and create sort of a new way to do something. And so that's whether it's our health or whether it's a routine. Because the other thing that often helps our memory is creating a routine in our day. And so if you don't have one right now, really spending some time thinking about your routine. And even though parts of your routine have been taken away, it doesn't mean you can't create some new ways of moving. Talk to others, find out what they're doing. Call your Lakeshore staff, find out what suggestions we might have to offer you. And if you're having some areas you're not sure how to think outside the box and maybe how to challenge yourself to get that routine, that need met. Okay, so that's a big talk. I'm sure I know there are more things I could say, and you may have had some thoughts, so there's way more we could discuss on the causes of memory loss, as well as on ways to improve, maintain, or kind of manage when we're having difficulties with memory. And so be patient with yourself. The more patience, the more positive. So positivity doesn't mean we have to like something. I may be struggling with my memory, and an example of being negative toward myself would be thoughts like, what's wrong with me? Why can't I do this? Could always do this. I don't even know if there's any purpose to my life now. And so those are as an example of when I'm maybe going through a transition in my lifestyle. And we do transition, we do change every 7 to 10 years. Some of our transitions are just more pleasant than others, or things that we dreamed of and wanted. A more positive example is I don't have to like my memory loss, but I might say something that's a little more neutral than, what's wrong with me? So a positive interaction with a memory problem I might be having would be, wow, what's going on? I just walked in the room and I can't remember what I came in here, and that's happening to me a lot. I wonder what's going on with me. And so we can judge ourselves, or we can step back and observe to understand. We can judge ourselves as being moody or depressed, or we can judge ourselves for not having the same memory that we had 20 years ago, or we can step back and try to understand what our symptoms, what our body and what our mind is trying to tell us, what it is that we're needing. And sometimes we're that saying we can't see the forest for the trees. Sometimes we're too close to ourselves, and we really need to support ourselves to have a little bit bigger team and to define who are those people, places, and things that I can go to get a better understanding of myself and the system I'm living in when my empathy for what's going on with me is low or non-existent. And how can I be the best I can be with what I have at this moment in time? That is maybe what inner peace is about. I hope you have enjoyed today's discussion, today's talk. I hope I've given you some food for thought. I hope that you have some maybe ideas of some things to try out or to apply. Let me know. I think of you. I wish you each the best. I hope you're being gentle and patient with yourself. Again, we don't have to like something, and we don't even have to accept something to interrupt the loop of negativity. We can have goals, we can have purpose, and we can support ourselves to be the best we can be, and in that process to try to understand what's happening when we see ourselves or someone else maybe not operating at the optimal level that we think we should or could be on. And with that, taking a deep breath, letting out slowly, Just take a moment to check in with yourself. Take care, and I look forward to seeing you next week or throughout the week in the community when our paths cross. Or if you ever want to reach out with a note to me or a phone call, please feel free to. And be well. Talk to you soon.